Hello everybody, welcome to the Thursday edition of Video Clips, and just one quick announcement. The conference is scheduled this year for November 8th through 10th. Ticket prices go up regularly. The sooner you buy, the cheaper it is. Includes great meals, the whole 9 yards. We have great speakers coming, and we just added Dr. Gracie Yuen, who has opened a fasting center here in Ohio, and Dr. Saray Stanzik, who is the producer of the new film Code Blue, which I'm in, and we're going to screen at the conference. So if you haven't seen that film yet, you'll not only get to see the film, but you'll get to have a conversation with the producer of the film. And she's a great lady. I had the opportunity to meet her when she and her business associate came here to film my portion of the film, and also have heard her present at other conferences that I've attended, CME conferences. And I think she has a great heart and a wonderful desire to share terrific information with people, and you just have to love a medical doctor who's talking about eating plant food, right? Well, one of the things kind of leads into today's topic. Dr. Stanzik developed multiple sclerosis when she was a medical student, and thought, my gosh, this can't be happening to me as young as I am right now. And that's what led her to plant-based nutrition, and she's eaten her way out of that multiple sclerosis. So a lot of times great doctors have great personal stories which motivate them to want to do great things, and she's one of those docs. So the title of this article is Medical Ineptitude, and I think you'll understand why when I start getting into this. So a study of patients diagnosed with multiple sclerosis who were referred to 2 medical centers in Los Angeles for treatment shows that 18% of them were misdiagnosed. The misdiagnosed patients spent an average of 4 years being treated as if they were multiple sclerosis patients before the misdiagnosis was discovered. The corrected diagnoses included migraine, radiologically isolated syndrome. It's a condition where a patient doesn't have MS symptoms, but a lot of the test results look similar to those of MS patients. Neuropathy, spondylopathy. Well, of those patients misdiagnosed, 72% were prescribed treatments that are typical of the ones that are prescribed to multiple sclerosis patients, with 48% of them taking drugs that are known to increase the risk of developing progressive multifocal leukoencephalopathy, a brain disease that is caused by viral infection. Now, the financial cost for treating 44 patients for MS who didn't have it, almost $10 million. $10 million in 4 years spent treating these patients who were given unnecessary treatment. Just 44 people. The cost in terms of damage to their health is also significant. And I have a list here. It's a very, very partial list, but these are some of the drugs that are typically prescribed to multiple sclerosis patients along with their side effects. So corticosteroids are often prescribed, and the side effects would be, we could talk about this till next week's video clips and not run out of things to talk about side effect-wise, but the common ones are psychosis, bloating, insomnia, headache, bone loss, immune suppression, stomach ulcers, glucose dysregulation. Interferon beta. Side effects include injection site reactions, flu-like symptoms, liver damage, and depression. Avonex. Side effects include flu-like symptoms, depression, drop in white, red blood cells and platelets, allergic reactions, seizures, risk of miscarriage, and heart failure. Rebif. Flu-like symptoms, abdominal pain, depression, abnormal liver tests, thyroid dysfunction, shortness of breath, tachycardia, and risk of miscarriage. Capaxone. Vasodilation, rash, shortness of breath, chest pain, injection site reactions, flushing, chest tightness, heart palpitations, anxiety, and trouble breathing. Methoxytrone. Side effects include nausea, hair thinning, loss of menstrual periods, bladder infections, mouth sores, heart failure, low white blood cell counts, increasing risk of infection, low platelets, increasing risk of bleeding, change in color of the eyes. Well, there are more, but I think you get the idea. These drugs cause serious side effects. They're also expensive, by the way, and even worse, they are useless. One research group concluded, quote, among patients with relapsing remitting multiple sclerosis, administration of interferon beta was not associated with a reduction in the progression of disability. The researchers also wrote, the ultimate goal of treatment for MS is to prevent or delay long-term disability. Our findings bring into question the routine use of interferon beta drugs to achieve this goal in MS. According to the Cochrane collaboration, all medications prescribed to treat multiple sclerosis are ineffective. Within 10 years of diagnosis, over 50% of patients are walking with assistance, confined to a wheelchair, or dead after receiving the best and, as you have seen from my previous comments, the most expensive treatment available. The uselessness of drugs for MS patients became very public several years ago in the United Kingdom when the National Institute for Health and Clinical Excellence, or NICE, recommended against the use of interferon beta, Copaxone, and Rebif. The multiple sclerosis risk-sharing scheme involved monitoring patients to confirm the cost-effectiveness of the drugs, and it was agreed that the prices would be reduced if the outcomes were not as good as predicted. Well, the first report was issued in 2009, and it showed that the patient outcomes were significantly worse than expected. NICE announced that the drugs were not cost-effective treatments for MS and could not be recommended for reimbursement by the National Health Service. It was even suggested that the drug companies should pay the NHS, since many of the patients who took the drugs were significantly worse off than patients who took no drugs at all and did nothing at all. In other words, patients who had no treatment were better off than the patients who got the standard of care treatment with these drugs. The drug companies' response? Hysteria. They became apoplectic. None of these problems constitute compelling reasons for disregarding the terms of the scheme, which specified using 2-year results to set prices, and they ranted and they raved, and this went on for a very long time. Well, the hysteria over the findings and attempts to change healthcare practices in response to them led one researcher to make this statement, quote, "Outcome-based schemes should probably be avoided if at all possible." Think about that for a minute. In other words, since studies show that treatments are harmful and useless and changes are needed, well, it's best just not to look at the facts. Well, that will fix it, won't it? There's no question that diagnosing multiple sclerosis is difficult. Back to the original thing that I started talking about here, the symptoms are often vague and relapse and remit during early stage disease. Both symptoms and images can indicate other conditions, which is what happened in this case, like stroke, migraines, B12 deficiency. Some patients are thought to have psychological disorders because of the relapsing and remitting nature of the disease. The doctor's appointments are set so far in advance that people go into remission on their own, and then they start talking about symptoms that have gone away, and doctors start to think, I don't know, maybe this person has some problems. So having said that, again, giving doctors the benefit of the doubt here, it is difficult to diagnose. I think it would be better to err on the side of caution when you're dealing with drugs that are, well, the first thing, err on the side of caution when we're dealing with diagnosis, and doctors should actually start reading the medical literature and stop prescribing these useless drugs. Really, patients are better off doing nothing. The best thing would be for them to use diet and lifestyle changes as a way to try to stop the progression of their disease, and that often works. Well, I'd love to tell you that this is an isolated incident and everything else is just great out there, but that's not the truth. This type of ineptitude is not limited to the misdiagnosis and mistreatment of multiple sclerosis patients. Another study that I came across in the last week, this must have been Ineptitude week in terms of news feeds, showed that preventive drugs are often prescribed to older patients with terminal cancer. Researchers looked at the use and cost of preventive drugs for over 151,000 older people with fatal cancers during their last year of life. They reported that the average number of drugs prescribed in the preventive category, increased from 6.9 to 10.1 drugs on average. And we're talking about drugs like antihypertensives, blood thinners, statins, and diabetes drugs. Quote, "The use of preventive drugs should be reconsidered, you think, in light of the patient's goals, care, values, and preferences. Reducing the therapeutic burden on individuals with advanced cancer has the potential to not only reduce unnecessary adverse effects and improve patient quality of life, but also to reduce the financial burden for patients." And while we're on this topic of terminal patients, I remember so well from last year's conference when Cheryl Atkinson, our keynote speaker, talked about how she got interested in being an investigative reporter in the area of health. Her grandmother was dying. She moved her into the house with her to take care of her and looked at the pile of drugs and said, "I don't think a dying person needs these drugs." Threw them away, and within a few days, Grandma woke up, started walking around, and went back home and lived for a few more years on her own. So we should be prescribing less drugs. I mean, doesn't that tell you something? Again, the title of this article is Medical Ineptitude. It doesn't get much more inept than that. Screening tests are also routinely administered to older and very sick people. A study of men treated at Veterans Administration medical centers showed that 39% of elderly men with limited life expectancy were given a PSA test. The type of physician the vets saw dictated the prevalence. It was 82% of older men with limited lifespan who saw a urologist. And of course, urologists do prostate surgery and that sort of thing. So of course they're administering PSA tests to people who are dying. So what possible benefit could be derived from screening men with a short life expectancy for a cancer that is usually slow to progress and kills less than 3% of all men? Well, even cancer center guidelines advise against doing this. Men over 76 years old are not supposed to be screened. Well, the reason is really an evangelical belief in testing. Doctors are they make up their mind about something, and they do not want to be confused with facts. The whole system it's made up its mind of something, and it doesn't want to be confused with facts. They're slow in changing their ways. And here's another thing, and I hate to say this, but there's no reimbursement for doing nothing to people. Okay, so you get paid to be busy. And the only way that you're busy and can get reimbursed is if you're testing people for something and you're treating them for something, and etc. So all of this points to an unavoidable conclusion. The medical system needs reform. I mean, we talk about that every week here. It's not going to happen quickly. Powerful companies and institutions and professional associations are sharing in this huge $3.5 trillion just in the United States pot of money. And these people aren't going to give this up easily. So it really points to the fact that you, the consumer, have got to be in charge, and you've got to be informed. And I don't want people to disrespect the medical community. That's not what I'm proposing here. But I talk a lot anymore about the way we buy many things. And, you know, I like our landlord a lot here. I do. That's why we signed a lease to extend the time here. But when I signed that lease, it's for $1 million, the renewal is. I read the document. Because even though I like him, I read the document. It's $1 million. What kind of nitwit says, I'm going to sign this and not take a look, right? So my point is, if over something like money, you take the time to read the document, over something like your body, don't you think you should check things out, particularly when the downside can be so devastating as we're talking about here? All right, that's all for today and for the week. Hit the subscribe button if you're not a subscriber. As always, pass this on to anybody who you think might enjoy watching it, and I'll be back to you next week with more news.